Welcome, everybody, and thank you for joining us on our Reactive to Proactive podcast covering the blueprint for sustained fall reduction. My name is Richard Earzz, and I'm a social care advisor at Care England, and I am delighted to have the opportunity to talk to you today about something incredibly important: time, the blueprint for sustained falls reduction in adult social care. We know falls are the biggest cause of death for people over the age of 80. The cost of the system and the individual are more significant than they've ever been. Traditional care models achieve what they've always achieved, and it's now time to think differently about falls and to start to question how we deliver care in our services. Today's session it builds directly on an earlier caring and conversation we've had about falls prevention and the shift we urgently need to see across adult social care away from reactive crisis management towards a more proactive, preventable approach using technology. We know that falls are not just incidents, they're often the tipping point into a loss of confidence, loss of mobility, deconditioning, hospital admission, and for many people, a permanent decline in quality of life. Yet too often the sector is structured to respond to after harm that has occurred rather than preventing it in the first place. So today's discussion is deliberately practical. Rather than talking in theory, we are looking at real cases and a real case study from Arms Care Group, where Raj Segal, the group director, who will introduce himself shortly, will talk about how he and his team have applied a different model of thinking towards falls prevention. This is not about product promotion, it's about examining what happens when providers take a strategic data-led approach to safety and prevention and what the provider sector can learn from that experience. So firstly, Raj, welcome. Would you like to introduce yourself?
Hi, Richard. Yes, thank you for that introduction. My name's Raj Sehgal. I'm the CEO of Arms Care Limited. We're a small provider based in North Norfolk. We've got a group of 6 homes. And as you said, Richard, the emphasis for us has been on effectively dealing with falls on a proactive basis rather than reactive. All too often, we've been all working towards dealing with falls after the event, and it's possibly too late for a lot of people. The technology that we've looked at has basically alerted us to falls before they happen. So it brings a lot of new technology into the mix that actually improves the quality of lives of our residents, brings in new technology which has never been used before, and it's cost effective and brings back so much time to our carers. And later on, I'll go through how we've managed to do that.
Time is the real challenge here, giving that time back as well. Brad, would you like to introduce yourself?
Yes, thanks, Richard. And hi, Raj. I'm Prad Thiruvenkatanathan. I'm the founder of Ears. We're a business based in London. We've been working very closely with Raj for quite a number of months, in fact, a couple of years or so now, Raj. And it's been a fantastic journey. We started off learning a lot about what is needed and also building a solution that now truly helps in the sector. And I'm keen to talk a little more about the results that we've achieved with Raj and his leadership as well in operationalizing a lot of the results that we're going to talk about today. So keen to jump into it and show you some of the work that we've been doing.
So probably back to you, Raj, really for the first question is that why was it time to change the status quo? You've been doing this for a couple of years, but what drove you towards wanting to implement this change?
Actually, it was a personal thing for me, really. So I suffer from sleep apnea, and I was using an app that helped me monitor that. And I know very well that if I hadn't slept well at night because of that, I was at risk. And actually, my risk was a personal experience where I actually had a car accident where I fell asleep at the wheel because I didn't sleep properly the night before. And that really woke me up to the whole scenario of how we can prevent accidents from happening if we were to introduce technology that helped us to sleep. And that same application applies to anybody, the elderly in particular. And so one of the things from a personal experience, that actually helped me to look at something. So when I met Prad at some technological expedition somewhere in Birmingham, we looked at their product and we put the two applications together. We sat, we discussed it, we looked at things. We gave Prad the sort of ideas and he had the technology, and he put it all together, and we came up with something that actually would help us to reduce the number of falls, and not only reduce the number of falls, but actually almost predict if somebody was vulnerable to falls for perhaps the following day, like I myself was when I had the car accident. it's evolved from there. So as Prad said, we've been working for a number of years. We've been testing, we've been trialing, we've been going back, we've been looking at the data, we've been putting it back together. And now we have something which has basically, it's been a transformation for us and our service users. And I'm 100% convinced that it'll be a game changer for the entire industry.
That's a very personal story, but it helps bring it to life as to why you want to do this, take this proactive approach to making sure the accident happened in the first place, just taking things back, the root cause analysis. Very, very helpful. Now, it's thinking about the intention and the need and the innovations across the sector. Prad, do you think you could build upon what Raj has explained and bring to life the technology used in today's case study?
Yes, of course, Richard. So just as Raj was saying, we what we discussed and what became very obvious during our conversation was Raj's emphasis on sleep. And as we began working very closely with each other, it also became obvious that there is a large cohort of people in care today who can't quite press a button to call for attention, although they've got all these call systems available. And that cognitive barrier also eventually leads to restless nights because they tend to vocalize and call for support. And that happens without a check because they may just go about, because the carers may not even know that the person's shouting or calling for support or even moving in the room. So that's something that came up as one of the key elements of what the needs were. And again, in terms of the technology, what we did there was to use acoustic monitoring, but not in the traditional sense. So what we did was to this is the system in itself. I don't know if you can see my video, but it's the pod. It's the size of a golf ball. But the intent here was to try and build the intelligence for this system to understand, recognize, and delineate those specific sounds of movement in the room or even vocalization when a person calls for assistance. And that's something that we began training this little pod to recognize and analyze the patterns of automatically and alert the carriers when those specific sounds were heard. And this is something that truly made a big difference in the first few iterations of the product, where we began working with Raj to understand how this could truly help. And that was the premise to how the innovation came about. But beyond that, what we now do is something even more leaning towards the proactive side, not just reacting to these sounds, but actually understanding patterns of behavior based on the sounds to work out what the baseline behavior is and anomalies in the baseline too. Why is that useful? When you think about elderly care again, it becomes very obviously useful because it can tell when the person's intending to exit the bed or even vocalize for attention. So the carers can get proactive alerts and they could go and intervene and prevent falls from happening or reduce the risk of falls at least. In dementia care, as I was saying before, there are quite a few people who may not have the cognitive ability to effectively push an active call system to call for support. And in those types of instances, having the ability for the system to recognize these sounds and when a person vocalizes or when they shout, for the system to automatically understand that this is what is happening and then alert the carers could help proactive interventions as well, which obviously try to minimize the risk of falls. But beyond that, it also helps them get better sleep. And as Raj mentioned, sleep and fall risks are quite correlated. And that's something we learned a lot through our initial deployments and initial work with Raj as well. From a nursing perspective, again, we built in the ability for the system to identify coughing trends, shouting trends, screaming patterns. And all of these were then used as a way of tracking changes in behavior and alert carers or management teams to abrupt changes in behaviors that could facilitate proactive care as well. In the last conversation we had with Care England, we talked about the case study with Gold Care as well, which leaned more towards the proactive care side. But these were the core elements that we then started building the system. A lot of that was informed by the learnings that we had from Raj's homes as well, and Raj's own insights into how we would need to build those systems. One other key innovation that came through in that was a monitoring system is not about just alerting or even sending the right alerts at the right time, but also tracking whether those alerts are being used and operationalized in the care home environment. And that's when this entire concept of digitizing room checks came into the system. We then transformed this little button to recognize when once an alert is sent, how quickly are the carers going in, which rooms are being responded to, which rooms are not being responded to, and then add reporting functionalities that clearly indicate all of this in a management dashboard type environment. And this truly helped transform care practice as well. So as Raj will go into more detail soon, it truly helped reduce the risk of falls, and you would see what sort of an impact it has had in Raj's own homes. But we began tracking over an 80% reduction in falls across the portfolio in the 2025 deployments that we did, which was an amazing achievement for us because we then began understanding that this is the, recognizing the intent behind bed movement or vocalization would truly make a tangible difference in moving from a reactive environment to a proactive sort of approach. And because we were tracking these checks as well, it became very obvious that evidencing becomes a key part of any care facility. And we were able to evidence the fact that carers were responding not just 20% faster, but 20 times faster than a traditional 2 hour room check. And again, these are numbers we would show as part of this demonstration. Even in Raj's own homes, we're going to walk through Terrington Lodge and Docking House, where these numbers have been achieved consistently, not just over a couple of days or a couple of months, but over a period of about a year or so. So you're going to see a lot of that impact coming through. And the most important achievement, in my opinion, is the improvement in sleep. I think sleep is such an underrated problem. And if we are able to do anything here to truly help improve the person's quality of life, it can make a world of a difference in care. And I think this is going back to what Raj was saying before, putting the onus on sleep and understanding how we can best optimize that was one of our key areas of study as well as we improved upon our offer with Raj. And that's something I would love Raj to maybe comment upon, starting with the journey that we've had at Terrington, Raj.
Yeah, I guess typically in a care environment like ours, at night time, we would conduct hourly checks on our residents at night to make sure they were asleep, comfortable. And what we found was that you'd go in, you'd open the door, you'd have a look, you'd maybe check them. And literally, the second you closed the door or the light would go out, there'd be a click on the door. It could be that in that moment, the resident wakes up just as you leave. And that is the moment of the greatest risk where that resident wakes up and has a fall. But your next check is not for another hour. So, you're not going to know. Now, if that resident is at risk of falls, you'd have the necessary fall prevention sort of equipment in there, like pressure mats and movement sensors and all that sort of stuff. But unfortunately, by the time that resident's feet have hit the mats, it may well be too late because they would have fallen. You would have been alerted on your nurse call system, and you run to the back to that room. But unfortunately, the resident has already fallen. So this is where we found the whole system, the existing system, is reactive. Something happens, you then react to it. With Earzz, what we have found is that actually we get alerted before that resident's feet have hit the ground, and you know that they're awake, and therefore you can attend to that resident before they've even got up. So two things happen. We mentioned about time earlier. Now, if you've got a 40, 50 bed home and it takes you 1 minute to go around every room and just check that resident, make sure they're okay, sleep, whatever, you're talking about 50 minutes in every hour that somebody's got to go around and check every single resident. And by the time you've been around every single room, it's time to start again. So that night cycle just continues. You can imagine one full-time person, all they're doing is night checks. Now, what we found is that with Earzz, actually, you don't have to go into somebody's room to check unless it's on their care plan or unless there's a special note that they need to be checked every half an hour, 2 hours, or whatever it is. But generally, you don't have to check because the system will alert you when they're awake. And it sort of recognizes the sounds of concern and it will alert the carer that, so and so in room 6 is awake and possibly needs checking. So the time that's saved, if you've got a care home with 50 residents at night, that could be one person's full-time job that is saved. And as we said earlier, in an environment where we're all short-staffed, particularly night staff, it's very hard to find. If you can make their life easier by not having that number of night checks, then you're actually freeing up a lot of time. Graph there shows the number of checks that have gone in, and it's actually come down. So the time saving is huge. The other thing is, as I said earlier, is that if you're not going in someone's room every hour, you're likely not to be disturbing their sleep pattern. So therefore, somebody could potentially be going to bed at, say, 10 o'clock at night and not waking up till 6 o'clock in the morning. They're effectively getting a good 8 hours sleep. And we all know that if we get good 8 hours sleep, we're much brighter and more alert in the morning. On the other hand, if we're in bed for 8 hours and we're woken up every hour on the hour, imagine what your day's like when you've been woken up every hour on the hour for your next day. It's going to be groggy. So again, what we've found with ears is that if a resident has a restless night and they are awake at night and they vocalize at night, they're going to be more at risk of falls the following day. So again, the system tells us that Richard in room 6 has been up all night and he's been vocalizing, he's been coughing, he's been making noise. Now we know to watch out for Richard the next day and to make sure that he's in an area where he's better supervised and less at risk of falls during the day. So not only are we eliminating nighttime falls, but we're actually now using the system to actually predict somebody who's at more risk of falls during the day. So we're reducing it all round, which is absolutely fantastic. And as the statistics show, we went from an average of about 13 falls a month, which in a typical sort of 30-bed home is not uncommon. And we've now gone to 0 falls because we're actually able to get to those residents beforehand. Now, you might say that's a fluke. And you can see from the figures there from April before we started 13 falls on average in a month, following month 9, 7, 2, and then to 0. Now, it might be a fluke, but you can see there is a clear pattern there. In a second home, when we introduced it, we had, again, from December in Docking House, 0 falls, 0 bedroom falls since December. Now, again, that's the staff getting used to the system, the staff understanding how the system works, the management using the information that's provided by the system to better recognize where the risks are and actually care planning for those risks. Again, 2 months on into the new year, 0 bedroom falls. Clearly, something is working and it's right. So it's all about using that information to prevent daytime falls, but also eliminating nighttime falls as well.
Coming down to those room checks being incredibly inefficient, the traditional methods that we tend to adopt are incredibly inefficient in terms of providing good quality care. We're almost self-perpetuating and creating residents to almost have falls by the way in which we provision care. So we do need to change that behaviour, and this technology has allowed you to do it, and it's delivered some pretty amazing results. So to seeing those falls drop to 0 is phenomenal. I mean, the cost, the economic impact of those falls is absolutely phenomenal. And I wonder whether you could maybe just touch on the wider economic realities of those falls and the safety outcomes, Raj.
Well, I guess the biggest beneficiary of this technology is going to be the health services, because you can imagine every fall, if somebody falls in the middle of the night, you then have to have a member of staff that's with them, and you call the paramedics. Paramedics have to come. If you're not a nursing home, they have to be checked out. Because they know that they're in a care environment, they may not come out for 6 hours, 8 hours, 10 hours, 12 hours, not even till the next day. In which case, you've got a member of staff that's sitting with that person. So just the cost of not having to do that is quite considerable. The other issue is that, if people don't have falls and they're not ending up in hospital, then the cost of the health services is whatever it get cost of calling out paramedics, the health services, the beds that are taken up, the fact that somebody is likely not to return back to the home if they've had a fall and end up in a nursing environment as opposed to back in the care environment. There is a cost to that as well. So I guess from our perspective, it's not just the time saving, it's not just the saving to the health services, but also from a care perspective, that we are providing far better quality care for our residents. And if we can demonstrate that, then those residents are with us for longer. And therefore, there is a cost benefit to that as well. Out in the community, if people realise that actually you've got residents that are at risk at falls and you've got the technology that can reduce that risk, then you are more likely to get those residents into your home than into a home that hasn't got that technology. So there are so many unwritten benefits to this in terms of cost and savings. I would be hard pushed to put a figure on it, but I think just the whole change in the way that we react to this and how we look after our residents is a game changer.
But bottom line, you're providing a better quality of care to the residents. So residents are happier, healthier, living better lives. The care home itself is making efficiencies. It's got more efficient staffing. It's more proactive. It's less reactive. It's more efficient as an organisation. The NHS is saving money because we've got less of those paramedics coming out, less ambulance calls, less admissions to hospital. So no one loses as a result of this. It just created efficiency throughout the whole process. And bottom line, the most important thing is we provide better quality care to those that we're looking after, that's the main benefit for us, isn't it?
Absolutely. And it's the quality of care that is key here. People not being injured, people not falling over, people not ending up in hospital. That is what we do. Our job is to care for those residents the best we can. And this system actually allows us to do that. And it demonstrates quite clearly 13 people didn't fall last month that would have fallen if we had not had this system in. And this is in a home with 25 residents. So that's what's that? Over 50%. And that is a massive, massive impact on the home. That means the difference between putting 4 carers on at night and 3. Because again, the system will allow you to monitor their quality of sleep and far better than any human intervention will.
And could I also add to what Raj is saying there, Richard? So one key point I want to emphasize here is it's a statistic that I came across, which I think startled me the first time I came across it. So in terms of the number of people in care today, in care homes today, elderly care, it's 450,000 people in care homes today in the UK. And an interesting statistic when I looked at references from the Alzheimer's Society, as you've got in the bottom left of the slide there, and NICE as well, was that 70% of them may not be able to effectively use a call system to call for support, although every single bed that we have today has a call system. So that's a finding that really shook me the first time I read it. And I was then thinking, how would they then call for support or assistance if they cannot execute a call button push? So that's when the passive monitoring and the whole regulatory angle came in. And I was trying to understand the CQC regulation 12.9 and all of these things. I was reading through all of those to understand how we now need to better help. So you mentioned the quality of life and the transformative impact on the quality of life, Richard. And Raj mentioned how that he's seen it in practice here as well. And I think fundamentally, this comes with the ability to alert carers for specific events, including vocalization, so including kinetic movement, including all of those things. So it's an engineered solution for this challenge, I think. It's so understated as a problem, but I think that's one of the key reasons why you also end up having falls. If you don't have an ability or a method in which people know when assistance is required, why would they go in? So there is that too.
Absolutely. And I think, from Raj, from your perspective, just there is a commercial, there's a cost to implementing technology, and providers need to think about where they invest money. There's a lot of technology out there. Where are they going to focus their money? So, I mean, how did you view the sort of the technology spend? What was your kind of like decision process, and how did you end up on what justified the return on investment for you?
We looked at a number of products that are out on the market, and again, most focus on reactive measures in terms of it's something happens and then you attend. So quite often it's too late. This is preventative. And I think for us, that is the key. It's the time element. Now, in one particular home, we had staff meetings. So we need another person on at night. We need another person on at night. And you work out the cost of putting on somebody on for 12 hours, 365 days a week. You're looking at an additional several £100,000. People don't realise that. It's 70, 80 hours a week extra throughout the year. That's what it costs us. The fact that we've had Earzz in and now got those very same staff saying, actually, do you know what? We're quite happy. We're content because we don't have to do these things. We don't have to go out and check this every hour. That saved us just in time element alone, and also staff satisfaction as well, because again, they're not rushed off their feet. So when you start looking at the sort of cost benefit analysis or return on investment, it's not just the time saved, but it's also the fact that your staff are less pressured. So many things come into it. And then you've got other systems where they're like £1,000 a unit. And you think, so if you've got like 100 beds, you're talking about £100,000 investment. Whereas here you could be talking like a pound a day to save somebody's life. Now, if it's £1 a day to save somebody's life, that's 300 odd pounds a year. It's a minuscule amount. If you had to spend that just to save somebody's life that could have fallen, broken a hip, ended up in hospital and possibly passed away with other conditions related to that one fall. Now, it's a no-brainer, and that doesn't count the cost of, if you spend a night in A&E or an intensive ward care unit, it's well over £1,000 a night. So a prevention of one fall could save you tens of thousands of pounds in terms of paramedic costs, hospital stays, the entire cost of the health service. Preventing one fall will pay for the whole system.
And that makes it's a very compelling argument. It's not just I mean, it's going to impact your occupancy. Your occupancy is going to be stronger as a result of it. You've got reputational damage, which is reduced. You've got the proactive element of providing care. Financially, it makes sense. Nobody loses out of implementing this form of technology. So, as far as you're concerned, it's a great investment because it pays for itself in no time at all.
It's an absolute no-brainer, Richard. I've been looking at it for a couple of years now, and everything that we've gone back with, every concern that we've had, every idea that we've come up with, that we've discussed with the Earzz team, they've managed to implement, not in weeks, in days, sometimes same day. And that could be things like, we've got somebody in room 6 that vocalizes during the day. Can we pick up those sounds? Sounds, as Dr. Pratt mentioned, that you've got people that haven't got the capacity to press a call bell when they need assistance. Now, in an environment where you've got challenging behavior and severe dementia, you might have somebody sitting in their room and somebody else comes in. Just that noise and that vocalization can be picked up by Earzz as a sound of concern. So there's so many other benefits, not just the fall prevention. The fact that carers can be alerted to those sort of things, and the system learns and picks up those sounds as it progresses. It's a complete game changer. But it's, again, as care providers, we're so used to doing things in a certain way, and our staff are so used to, we've always done it that way. CQC come in and say, oh, you must always, everything must be written in black ink on white paper and all this sort of stuff. But yet we have to think out of the box. And here we have a system that's innovative, it's new, it's fresh, it just ticks all the right boxes. There are no downsides to this. As we said, the cost is so minimal that actually it's a no-brainer. The local authorities have got to look at these sort of systems and say, do you know what? It's worth paying £1 a day, 365 quid for a year or whatever, just to stop somebody from falling. I think the NHS ought to be investing in this as well.
It's an investment to save money. And how many of your services have you got this implementing? Because I know you're rolling out further, aren't you?
Yes, we've got 6 services in total. We've rolled out to 4. We've been doing sort of 1 month at a time. I think the next 2 are scheduled in the next sort of 2 or 3 months. And literally every service has seen benefits to the system. And initially you get the resistance. I can't tell a lie. We've got staff that say, we've never done, no, we can't do that. We can't possibly use this. And there is this element of, the system actually reports back to you how long it took someone to attend a call, from the time that there was a vocalization and the time that somebody attended. If there is a fall and you think, hold on a second, you were alerted at 10 o'clock, you didn't attend that till 6 minutes past, that 6 minutes is when they fell, that person is at risk of falls, you should get there quicker. So there's almost this sort of, somebody's watching everybody that, that's going on. So people then, it's almost self-perpetuating that carers will rush to somebody that they know is at risk of falls, and hence now it turns around into, it doesn't matter if so-and-so's screaming, to get there quicker because they know that's being monitored.
Brad, in terms of like the AI model that's behind this, I wonder if you could just kind of share some thoughts on that, really, just to help bring to life exactly. We get very nervous when we talk about artificial intelligence, and because it can't take away from human intelligence. We can have alerts, but we need human beings to translate. I wonder if you could just kind of share some of your thoughts on that.
Absolutely. I think I just want to share this one slide, which I think would be quite telling of what Raj was mentioning as well. And it goes to your question here as well, to a certain extent, Richard. So I think this is a very nice case study. This is from a resident in room number 10 in Terrington, Raj. So it's one of those cases that we've gone through before. And what you're seeing here, because the system identifies each sound distinctly, Richard, so it's not an audio relay based system. It's not like a baby monitor, which simply relays the audio. It's actually understanding when the person vocalizes, when the person's coughing, when they're moving, impact sounds, all of those are distinctly recognized by the system. And something very interesting happened here with room 10B. When we first deployed into Terrington Lodge, the resident in room 10 had repeat falls. We were then able to go back and look at the data to understand what happens in this specific case for this resident before a fall transpires in the room. And interestingly, what you're seeing in the graph in front of you is a timeline of the different events that were picked up, episodes of events that were picked up by the system before the fall actually transpired in the room. And you can clearly see here the blue streaks that you see are shouting or vocalization episodes. Interestingly, this is just one instance of a fall where a fall was reported, but interestingly, the person was vocalizing a lot before they began moving. So, in other words, the person was shouting and calling for support, and then they eventually fell. When nobody came, they began mobilizing. And from the time they mobilized to when they fell, it was a matter of seconds. As Raj mentioned before, once your foot hits the floor, it becomes quite late at that point to go and intervene and prevent falls from happening. And this is something we noticed time and time again. And we began looking at the data on a repetitive basis. And interestingly, when we started looking at the patterns of falls in this specific room, this happened time and every single time. So you see this vocalization streak. And in all of those fall instances, we began seeing this pattern of behavior where the person vocalizes a lot before the fall instance. And so what we did was we then worked with Vicky, who's the manager there, to change the alerting sequence. So every time the person vocalizes, we would prioritize or triage the alert from the room. This alert would now sound different to any of the other alerts from other rooms that the carriers would receive. So they know it's a priority. It would sound like a siren in their phones. So they would intervene very quickly to prevent or reduce the risk of incidents. And interestingly, the moment we introduce this method, this happens. The falls begin dropping and the repeat faller stops falling. And then all of a sudden, you end up having a much safer environment. And we began doing this in an autonomous fashion from this learning that we just had to work out. We let the system now uncover a change in the baseline behavior. So if the person is now vocalizing more in a specific night compared to their usual baseline, the system automatically uncovers that information. It then triages the alerts from that room because the risk of falls may be higher because the person hasn't slept very well the very next day. So the system now does all of this autonomously. It understands all of this and it feeds that information into care planning systems as well. So we integrate with CMS solutions like PCS and Care Vision, and this becomes quite useful from a proactive care angle. Again, the entire point here is not to be reactive, but to move our industry into a more proactive culture and facilitating that by giving these behavioral anomaly information straight into care planning systems can truly help as well. That's something that we do too.
By isolating the behavior, you can then compare it to the baseline, you can address the need, and you can reduce the fall. So that's the process. It's phenomenal, and it's actually quite simple in terms of what you've done. Obviously, it's a very complex system, but you've made it sound quite simple. And you've demonstrated it's a real blueprint for person-centered, data-driven sort of safety and care that preserves the residents' dignity while really delivering measurable clinical excellence and leading to zero falls in some cases, which is phenomenal. That literally is phenomenal to be able to take a home that was having 13 out of 25 falls down to zero is outstanding. It's not about saving money, but it clearly does create efficiencies within services, which is how you justify the return on any investment. But overall, and most importantly, it really has enhanced care provisions. Raj, do you have any final thoughts that you would like to share or any closing remarks with those listening and watching today?
I think everybody needs to keep an open mind on new technology and AI in general. There's lots of people with different thoughts on the use of technology and the use of AI. And at the end of the day, we are a sector with over 130,000 vacancies. Now, if we can use some technology, something new, thinking out the box to actually bring that technology into a sector which is very traditional in its operation, I think we can make significant savings and we can demonstrate to our commissioners and we can demonstrate to people that monitor our services like CQC that actually we don't necessarily need the 10 people on shift because we've got equipment and technology that is beginning to bring the needs of our day-to-day operations down. Then I think we can demonstrate that safely and securely. Then I think we can all move forward and we can sleep better at night and our residents can sleep better at night.
We don't have to take people off of shifts. We can just use those people to do things with those that maybe are awake or those that are supported, provide better quality care. Brad, do you have any closing thoughts you'd like to share with everyone today?
A lot of what I wanted to say is what Raj has already spoken. So I truly echo Raj's thoughts here as well. We are here as a provider of technology to try and support the industry. So leaders like Raj definitely influence what we do. And that's what we want. We want to keep building upon the solution. We want to keep improving the solution on a regular basis as well. So if you would like to learn more about what we do, see some of the see the system in action, see a live demonstration, there's a little QR code there, or you can visit our website and or even connect directly with me. I'm sure Richard can pass on my contact details as well. Keen to connect with you all and take it from there.
What the case studies we've discussed today really illustrate is that there's something much bigger than just technology. It demonstrates that what happens when providers move away from existing traditional methods, away from accepting falls as inevitable, and instead asks the harder question about prevention, evidence, and accountability, and using data and technology to make better decisions, more about how traditional approaches to care can be challenged to enhance the overall care delivery and the resident experience, and potentially create efficiencies across the system. And that's what it's about. If we do what we've always done, we'll get what we've always got. So we need to think outside the box and look at things differently to create these solutions. There is no single solution to falls in social care. People will always fall, but I think what you've evidenced, Raj, at Arms Care is that experience does show is that with the right mindset, the right data, and the willingness to change traditional practices, outcomes can change meaningfully for residents. For care home leaders and for clinicians watching or listening to this, the key question is not should you buy a system, but rather when are you going to look at these systems and solutions to help you provide a more efficient, more effective service. We need to think about, are we still organised around responding to harm, or are we generally structured as organisations to prevent it? That's a question I think providers really do need to reflect on. So Raj and Prad, thank you both very much for today. I know we're not promoting any specific system here. We're talking about the opportunity to use kind of data and technology to change and shift the direction of thinking. But the transparency is exactly what the sector needs. More time to help providers make their own decisions and come to that realization that technology can help really solve those problems. And we will, of course, ensure details of what's been discussed today accompany copies of the recording along with the slides. I think it'd be really helpful to share those. And of course, we'll absolutely share contact details for those who might want to reach out directly. But I just want to say a huge thank you to both of you today, and a huge thank you to everyone watching and listening today. Thank you very much.
Thank you.
Thank you, Richard. Thank you, Raj.
Thank you.